Hi, Dr. Andy Fetterman here with RebuildDoc.com and our neuropathy protocols. We're going to go over the cold laser unit. What this is going to be targeted towards the toes or what areas that you feel or don't feel the neuropathy most, or your worst, most severe areas. So this will plug in and charge. So this is a rechargeable unit. It does a 15 to 20 minute session. There's a button on the back that you will hold down and it will light up. This strap is adjustable, so you're going to then put it on, and it must be on skin. So if you have issues more with the toes, you want to put it on the toes and the balls of the foot. You may tighten up the device to make it comfortable, but you want to make sure that you are not standing on it. Do not put pressure on it. You can break the unit. So you want to have direct contact to the foot at all times for a 15-20 minute session. When you're done with this, you want to then switch it over to the other foot so you're able to put an application to those areas as well. This can be used for the hands and feet at the same time. Again, my name's Dr. Andy Fetterman with RebuildDoc.com. Thank you.